Later in life, can these primitive reflexes, if they don't go away in childhood, what can happen in adulthood?
In adulthood, causes almost the same problems, but an adult can compensate much better than a child. But these reflexes in adulthood could cause, for example, attention deficit. Among adults, attention deficit is common, but there are some other type of reflexes. For example, the Moro reflex and the fear paralysis reflex can cause really strong anxiety, because mainly the Moro will increase the level of adrenaline and cortisol, and they don't know why they are anxious. It could be physical stress and mental stress as well, and the chronic stress is the worst because they can get the same negative stimulation and it will accumulate, and finally the brain will think that, oh, I am in danger, I won't work properly. The cortex will reduce its working, and the lower part of the brain, this brain stem, will, because it has responsibility to survive the bigger problems, and it will work a little bit stronger, and at the same time the cortical inhibition will disappear, for example with the Moro reflex, and the center of the Moro reflex will be more active because the brainstem has responsibility to survive a certain problem. So from two directions there will be some trigger to bring back the Moro reflex.
How quickly does an adult see results?
For an adult, between 8 months and 1.5 years, but if somebody will be able to do regularly, because it is really important, I would like to emphasize, everybody has to do the exercises every day. Our brain needs to get the stimulation every day regularly. My experience with adults, 8 months or sometimes 6 months. It depends on the person and depends on the problem.
Yeah, so I understand this relates to the neuroplasticity of the brain, and the child's brain is more plastic and therefore responds faster than the adult. Is that correct?
Yeah. And if somebody's reflexes were inhibited in their childhood, just they came back because any reason, some kind of stress, for example, an operation or medical problem or problem in the family, or death in the family.
Post-traumatic stress disorder.
Post-traumatic, it is really important. And they came back. It is a little bit easier to inhibit them than somebody didn't have the reflexes at all, because it is a little bit longer process.